Hello everyone and welcome to our 5 questions with series. Today we have one of our greatest community members, Luke Pezet. He's been with the community for a very long time, for many years. One of the pioneers implementing solutions on our HPCC Systems platform for a number of organizations, and he has a very interesting story on not just the way he has used HPCC, and he has become an expert also in ECL and other things, but also the type of applications that he has developed on top of it. Before we get into the discussion with Luke, and by the way, welcome Luke.
Thank you.
Good to have you here. Yeah. So
Happy
before we get into that, I want to introduce Luke. Of course, I don't think I can do good justice to Luke's story and resume, but he has been for 10 years as the solution and software architect for a pioneering web analytics data management company organization. He has had expertise and he has expertise in a number of solutions around big data and big data analytics, particularly when it comes to analyzing millions or even billions of records to monitor, assess, and improve performance of models, statistical models around description and prediction of outcomes. He is also an early employee. He's been always an entrepreneur, an early employee of a number of organizations, and he has founded successful startups throughout his life as well. And he has been the interim CTO for the Achievement Network. It is ANET, if you want to have the short name, which is a non-profit education company, and we'll be asking him today about a little bit about what they have done and how these achievements have impacted other people's positively in their lives. Certainly, one thing that we should mention now is that he has also a master's degree in computer science from Rennes University in France, and I think you will have hopefully a good couple of accents today between Luke's and mine, so I hope you enjoy this too. So again, welcome Luke. It is a great pleasure to have you here today.
Thank you, Flavio. Happy to be here.
So Luke, let's dig into this and let's go into the questions. So you have a wide range of experience in a myriad of industries and leadership roles. And I know that you have been around for a long time doing many things in technology, and many of them that are leading edge. But I'm sure you have one position or one leading role that you consider to be the most interesting. And which one would that be?
Well, I have to say it's really hard to pick one. I mean, for the past 15 years, I worked for startups. And I was lucky enough to work in an environment where I was always involved in technology to some degree. 15 years ago, during the last year of my master's degree that you mentioned, I worked in a mobile environment. And that was 15 years ago, so pretty cutting edge at the time. Then as a junior software engineer at IGOYUGO, I worked in .NET and Microsoft technology. As a software architect and CTO at Trifilms, I designed, implemented service-oriented architectures using Java technology. As an interim CTO at ANET, I implemented big data solution to process assessments using Hadoop technology. And these days, as a VP of software and solution architecture at Archway, I describe and design efficient and secure processes and solve big data problems using HPCC and other types of technology. So I have to say that I enjoyed all those positions and all the technologies that I was working with. But I do have to say that I enjoy more big data processing and analysis. So maybe that last position is, I would have to say, the most interesting.
Wow, you're absolutely right. Put that way, every one of those sounds quite interesting. I think the most significant area to highlight there is that most of those positions and roles have been in leading edge technology at their times, right? Yeah, surely mobile technology in 2019 might seem like something that has been already done for a long time, but
Right.
15 years ago, that was
Right.
leading edge too. It's just, yeah, you're absolutely right. You're, with that perspective, you're right. Every one of these have been leading edge and very interesting at their times. So big data, yes, certainly that's something that interests me and many of people in our audience as well. But let's get into the achievement network, the ANET specifically. So what does it do? How does this change in any way education industry, and more important, how do you think this may have a positive impact in lives of people?
Right. So the Achievement Network, or ANET, it's like a non-profit coach that I would say backs his strategy on data and has practices grounded in industry standards. So it's a non-profit organization that helps schools really and educators assess their students, pinpoint gaps in their students' knowledge, and help design collective action plans. So ANET really succeeds when students succeed. So they really have students' best interests at heart. And to accomplish this, the technology team at ANET is in charge of processing all those answer sheets from students in order to report to schools and teachers and other educators where their students are according to their objectives. So if you think about it, it's processing every single answer for every single question for every single student multiple times a year for all the schools involved with ANET. And ANET grew rapidly from like 13 schools in one state to over 500 schools across 10 states. So it's a lot of data to ingest and process. So technology was key to help scale like that. At the time, we chose Hadoop to process the data and integrate it as part of the existing ANET technology stack.
That is quite interesting. So, do you cover also higher education, or is K through 12 for the most
K to
part?
12, K to 12. At least at the time I was working there. I think there's still K to 12 right now.
Okay, very good. So let's move areas a little bit, and you know, I know that you've been with Archway Health Technologies for some time now, and I know that when you started with that, you were using some technologies, and eventually you ended up looking for alternatives, and eventually found HPCC and settled on it. So, what made you look for alternatives at the time in technologies for Archway, and why did you eventually decide to go on HPCC for that?
So at Archway Health, we believe healthcare delivery isn't perfect, but it's not broken. And so Archway is an organization that promotes better payment models that focus on better care for patients, which helps drive healthcare expenditure down. At Archway, we need to ingest and process vast amounts of data. The data comes in pieces. It's more difficult to ingest and prepare than at ANET, for example. Processing the data is also very complex, and in some cases need to follow specific rules like those defined by the Centers for Medicare and Medicaid Services when working in government initiatives. So after implementing Hadoop successfully at ANET, we logically looked at it and all its flavors at the time to ingest, process data, and deliver results for Archway. But in the end, it didn't work out. So it was not intuitive. It was difficult to explain to existing and especially new employees. It was hard to see into running processes and understand what was going on. Even much harder to troubleshoot unexpected results. It was difficult to maintain, especially when using it in combination with other technology.
Okay, so that makes sense. And how do you feel in that case that moving to HPCC made a difference? So how would you compare your experience later on with HPCC Systems versus what you had before?
Right. So when we face a problem actually with the dupe, we try to write a job description for the perfect system that we need to use. Right. We wanted something that is more intuitive, more developer friendly, something that helps us process vast amount of data, but also make processing easier with more built-in capabilities. Back then in the dupe, everything has to be pretty much coded, even just cross-tab reports. So we need something that could scale, creating summaries and reports from data, but also something that can help us deliver those. So we looked at other technologies, and we found two candidates, SAS and HPCC Systems. We look at SAS at first, being the de facto standard at CMS. The problem is that the licensing, this art programming language, the closed source and proprietary platform, the lack of scalability at the time, all that was a showstopper for us. So we look at HPCC system, and it seemed and turned out to be a perfect fit for us. Open source, developer-friendly, intuitive, can ingest and process big data, just as important. Provides very useful built-in features in its programming language, like rolling up records, generating vertical slices, and cross-tab reports. We really thought at first the learning curve would be much steeper, but the abundance of documentation, tutorials, the IDE, and other web tools greatly help picking it up quickly. So we use our HPCC system at Archway to process years of limited data sets, and that's sensitive data with patient information in it, and even claims from all payer claims database to run claim analysis using Thor. We process all the claim data provided by CMS as part of the many initiative we're participating in. Some of the outputs are delivered through Roxy, and others are ingested and further processed by other technologies like MySQL or Tableau, Python to present it to clients, for example.
That is amazing. That is very good. When you do some of this processing, would you be able to describe a little bit more in more detail what type of analytics you run? This sounds quite interesting. Just getting into the analytics of claims, for example, in healthcare, and doing this analytics for. I assume the predictive models will try to assess the best treatment or maybe identify fraud. I don't know if there is a way you can go into a little bit more detail.
Sure. So there's the different stages of processing, right? The claim data. The first one is really to gather all that data and to ingest it and prepare it. Because the problem in healthcare is that it's in varying silos. So you would have claim data for only hospitals, and then you have another set of claim data for skilled nursing facilities or from physical therapists, for example. And so first, we really have to merge them to be able to have a clear picture of an episode of care for a given patient, right? So in a new payment model, we need to see what really happened to the patient across the continuum of care before the episode happened, like maybe there were some complications before it even happened, during the episode of care, and after the episode of care, like you mentioned, to even see if there's any fraud or abuse during that payment model. So first, there's really this preparation that is very important, and something that is the basis of any analysis, further analysis from that. We started doing some more modeling and more predictions, but we just started on that front. To help with that, we started using some machine learning capabilities from HPCC, but we also have a team that use some other technology to help with that as well.
That's very good. That's useful. Yeah, I always find it fascinating to understand more about these domain-specific type of problems, right? They seem to be quite specific to that area, but also very interesting. Very interesting. So I don't want to make this too long. We try to keep as much as we can these talks short in 15 minutes or so period. So, but I want to close with I think an important question for you. You've been in technology for a long time now. You have a lot of experience. You've been in the leading edge of many different areas. What type of advice would you give to a young technologist that is trying to get into web analytics, data management, and other type of leading edge technology applications? What do you think they should do? What's your advice there?
Use a HPCC system? No?
And besides that,
well, I know it's not always possible, but when it is, I would recommend really trying different technology and not necessarily, stick to what's trendy or famous at any given point in time. I think there's no better way to fully understand the capabilities of a piece of technology than actually using it, testing it, experimenting with it, and to some extent even pushing its limits. Only then can you really find, the perfect fit of technology to help provide a great solution to your problems. And so one day it might be a dupe, and another day, like in my case, it was definitely HPCC Systems. And so really don't stick to what's famous, it's what everybody's doing. Just try to find the right fit for your solution.
That sounds like a great piece of advice. That's a balance, and I can see that you speak from experience. Yeah. Unfortunately, we all fell on that when we were young technologists, and we read books. So we tend to try to apply whatever was in the books, and sometimes books don't have that extra experience. Yes, absolutely right. Yeah.
Indeed.
Great. Thank you very much, Luke. This has been a pleasure, really, really a pleasure, and I hope everyone listening to this enjoys it as much as I did. Thank you.
It was a pleasure for me as well. Thank you very much.